Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you. Welcome to another edition of Health Matters COVID-19 Extra. I'm Hawa Solomon. Stay with me for the next 45 minutes as we uncap what's happening in your province. We focus a little bit on the Western Cape as well as the Free State. We chat a little bit later on to the MEC of Health in the Free State. So if you want to send any questions, comments and queries, please do that via our WhatsApp line. We will be taking your questions, and remember, you make the show. So tell us what's on your mind with regards to COVID-19. Stay at home. I hope that's where you are. If you're out for essential services, we will also have very soon a show just dedicated to our essential services within South Africa, working out and about, what they need to know, and just some advice as well when you're going out shopping, what to do with your groceries and coming home once you've been out, because they say you could possibly bring the virus back home. So first we kick off with our slogan for today, and that is by IMA representative, occupational therapist Wahida Esop. She's saying, in this rat race of life, we have been placed on pause. Have we really been placed on pause? Is this something that you've realized for yourself? But take a listen to this.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Wahida Esop, National Executive Member of the Islamic Medical Association. 21 days to remember. Day 1. In the rat race of life, we have been placed on pause, allowing us to refocus, to regroup, to restart. Allah always has a plan.
Allah, absolutely, all the Almighty has a plan. Hope that resonated to you, to refocus, to replan, to regroup, and to restart. We have been placed on pause, so let's just allow that process to happen. Thank you so much to Executive Member of the IMA, Wahida Esop. She is also an occupational therapist, and we appreciate her time for putting together our slogan for the IMA today. Next up, we will be watching just a short clip before we link up with our hematologist, and it tells us all about the confirmed cases that to date, the 14th of April, tell us about. So please watch this very interesting, informative video.
I think this is a great actual facility, and they've promised us that when we come next week Friday, we'll find that we already have 500 beds ready actually for use, and that's what we are intending. So the issue again about this type of operations is the turnaround, which must be quicker and more actually rapid. We're also hoping that we're going to put up a lot of actual structures, because we want to have structures that we can be able to use after the pandemic, not structures that we are going to destroy. So we know that we have pressure as a department. So we are going to put up structures in George Mokare. We are going to put up structures in Jubilee. We are going to put up a structure in Bara, at Bara Hospital. We are going to put up a structure in Kopano, so that we build our own internal health capacity in terms of our facilities.
We've taken the initiative to create some mock-ups. There are mock-ups. We're still going to further develop it from here, but what you have here is you have a mock-up facility that we can put people into into isolation, and the rest of the stuff that you see here is the ability to put people into quarantine and ensure that we try and curb this virus as much as possible. We have huge capacity at the venue, as you all see, but at the moment we're working with the health authorities to take it one step at a time, and we can build exponentially as the need requires.
Okay, so we will update you on the current number of cases, and that's a video called Confirmed Cases Surge from 143. That is an increase of 143 cases, because South Africa is now at 2,415. But we'll play you that video a little bit later on. That was an informative video with regards to what's happening with quarantine facilities that the Gauteng has had makeshift quarantine facilities in the province. So we'll tell you more about that later on as we discuss with the MEC of Free State also to find out what they have up their sleeves with regards to quarantine facilities. But for now, let's chat to Dr. Shahrak from Cape Town, our hematologist in the world of hematology. Very good day to you, sir. Thank you so much for joining us on ITV Networks.
Yes, hi, good afternoon.
So, firstly, we want to know, what does that mean, clinical hematology?
Well, a clinical hematologist is a physician that specializes in blood diseases.
Okay.
And 2/3 of blood disease is malignant or cancerous, and about 1/3 would be benign. And the type of malignancies or cancers that we see are your acute and chronic leukemias, your lymphomas or lymph gland cancers, and other types of bone marrow cancers like myeloma. And then we see on the benign side or the non-malignant side, the clotting abnormalities, your red cell, white cell, platelet abnormalities, and genetic diseases as well, pertaining to the red cells, white cells, or platelets.
Okay, so make us understand your role within COVID-19 status in South Africa, or at least in the Western Cape where you're based, as an hematologist.
Well, I think COVID-19 is slowly increasing like any pandemic will do, but I don't think it's at the moment out of control. As you can compare with international figures, I think we are still quite okay. South Africa is well preparing for the worst, but so far we haven't had any signs of major crisis yet. Perhaps a few exceptions in KwaZulu-Natal, where many staff members were tested positive. But I think in the Western Cape, it's still quite okay.
Okay, so just explain to us, the various blood transfusion organizations is still operating within the provinces. I was happy to do my donation at the local mall, which I visited when we were on lockdown. I was quite surprised actually to see them have their little makeshift donation booths up and ready. Explain to us why and how safe it is to donate blood during this time.
Well, I mean, look, we need blood, and this is a very difficult time, and we don't want to disrupt the blood supply because there are many patients that are on critical need for blood transfusions, platelet transfusions, and other blood products. So, I mean, to get to the units where the bloods are being given is usually by car. I don't think there is a lot of exposure. If you are really very worried, you can wear a mask. But I don't think there is unnecessary risk to the healthy donor in donating their blood products.
So explain to us the area where the COVID-19 patient would actually need blood. In which circumstance?
Yeah, look, if a COVID-19 patient that is critically ill, in other words, needs hospitalization, then he or she may need blood for complete different reasons. And we just incidentally also tested positive for COVID-19. So that is probably the most probably case scenario. The other case scenarios where the COVID-19 critical ill patient has become now so critically ill that that person needs a blood transfusion or platelet transfusion or clotting products for that matter, because as you may know, COVID-19 disease may be complicated by quite a few complications in the realms of clotting abnormalities. So that's why we have to keep this in mind. But I mean, these are only very complicated COVID-19 patients that do need blood products.
So if somebody possibly suffered from blood clots, thrombosis, for instance, prior to this whole COVID-19 case, it's not a chronic illness that they suffer from, maybe through their pregnancy or earlier years, would it be an issue if they contracted COVID-19?
Yeah, so any comorbidity is a risk factor for serious COVID-19 disease. In other words, type 2 or type 1 diabetes, uncontrolled hypertension, uncontrolled heart failure, COPD or chronic obstructive lung disease due to smoking, asthma. So these are all risk factors. But like, for example, COVID-19 per se can present with an increased tendency to clot. So we treat these patients, besides with oxygen, also with anti-clotting agents to prevent further clotting abnormalities.
Tell us the difference between a normal blood, those that have donated blood and they're not a COVID-19. Of course, it's a question that has been asked when you enter the blood donation booth, and that of a blood donation that is COVID-19 positive.
Well, so you are talking about donors that are COVID-19 positive and have not donated blood?
Yes. So the difference between normal blood and the blood infected with the disease of COVID-19, with that virus.
Yeah, look, COVID-19 disease is usually only restricted to the respiratory tract. So in other words, it's a respiratory disease. So, I mean, you don't really have necessarily the COVID virus, or we call it the SARS-CoV-2, coronavirus 2 in our bloodstream. I don't think that would be a major concern. I mean, I think the major concern of COVID-19 is that it affects your respiratory airways and in that way can cause severe pneumonia.
So you're saying that a positive COVID-19 patient can donate blood?
Well, let's put it this way, a COVID-19 positive donor, or rather a SARS coronavirus 2 positive donor that incidentally is tested later, for example, probably not prior, because why would a COVID positive donor now donate blood? I mean, that would be a bit strange. But if, for example, a healthy donor donates blood and maybe perhaps later was found to be carrying the virus in its nasal passage or oropharynx, then that would probably not be a major concern.
Okay, so in your case explained later a COVID positive individual that has recovered, and often within the questionnaire when you are donating blood, there's the question of have you had any respiratory infections, have you been ill in the past month? If that is ticked off yes, are they going to allow you to donate blood?
Well, if the patient or the donor rather had previously COVID-19 and has now become immune, that would be actually a precious source of blood, because there are some data that serum from COVID-19 positive ex-patients basically may be beneficial for active COVID patients. So because it contains antibodies. But I don't think that any donor that has not tested positive will be able to donate blood if he is known to be COVID positive.
Okay, so to round up in the world of hematology, what message do you have to all South Africans during this lockdown?
Well, I think the most important message I would like to give is that because it's a disease of the respiratory tract, in other words, it's a respiratory disease, that you need to protect your airways as much as possible. In other words, your mucosa, which means you have to stop smoking, diminish your alcohol intake, drink sufficient fluids. I always tell my patients, have your honey, your ginger, and your turmeric ready in your tea. If you have any symptoms of, for example, cold or cough or sore throat, rather than adding chemicals that may make things worse. Have your zinc supplements, perhaps vitamin B12 supplements, folic acid supplements, etc. And just have a healthy lifestyle, eat healthy, good nutrition, cut down on your carbohydrates, a bit more protein intake, and have some moderate exercise to keep yourself healthy and fit.
Dr. Shakrak, thank you so much for your time, your expertise on today's Health Matters COVID-19 Extra Show. In the world of hematology, we wish you well and keep going and doing the great work that you guys do.
Only a pleasure and all the best and
Goodbye
luck to
for
you,
now.
listener.
There you have it. Thank you so much to Dr. Shakrak for his contribution to today's Health Matters COVID-19 Extra Show. We have more with the MEC of the Free State, MEC of Health rather, in the Free State after this. Assalamu alaikum wa rahmatullah. Very good day to you. Welcome. This is Health Matters COVID-19 Extra every Monday, Tuesday, Wednesday, Thursday and Friday, weekdays from 4 to 5 p.m. You can catch the repeat as well over the weekend, and note that the Health Matters show on a Tuesday evening still shows at 8:30. You can be part of it, and this show. Please WhatsApp us your questions, comments and queries, and remember your information helps us produce the shows of what you want to see. So we know there's been a spike of 100, let's get this right, I think 143 cases within South Africa, and now we have the confirmed 143 cases, confirmed cases of 2,415 within South Africa, and 27 deaths. Over 87,022 tests has been done, and 26 more people have tested positive for the coronavirus within the Western Cape. Gauteng has a total of 909, Western Cape 643, KwaZulu-Natal 489. But to tell us more what's happening in the Free State, let's talk to the MEC of Health, MEC Monseng Tswa. Very good day to you. Thank you so much for joining us.
Thank you. I'm glad to have me and the viewers at home.
Great stuff. So it's a pleasure, and we appreciate you making time for us. Firstly, in the Free State, when we were just, knowing about our cases within the Western Cape and Gauteng, Free State was in fact one of the last provinces that had positive COVID-19 confirmed cases. How did that better prepare your team for your first confirmed case?
Yeah, we actually did not wait for us to have the confirmed cases. We started way before we could have confirmed cases. We started by preparing first the hospital that would be used as our COVID-19 hospital, which we chose the Benoni Hospital, our biggest regional hospital, where we prepared at first 37 beds, isolation beds, and we also prepared ICU beds at the universities where we have the ventilators. We made sure again that we train our staff, some of the staff that will be allocated to deal with the patients, the COVID-19 patients. Also prepared our community health care nurses so that they are able to go to homes of the people that we would need to trace as the contacts. That we indeed, we also purchased PPEs so that when that time comes that we have a patient, we are ready. We purchased some. We have just increased the number because we have seen that indeed we are still expecting more to get more people that will be confirmed with COVID-19. So we've purchased more of the PPEs. We also employed more nurses so that we can have more staff. As we have a chronic shortage of staff in the department, we try to increase the number of staff so that we are ready to deal with the COVID-19 when it happens.
So MEC, we understand that there was quite an increase around the 24th of March in Bloemfontein with regards to the church gathering. What has your department learned from that, and what has now been implemented?
The time when we our first confirmed case, it was not one. We had 5 at a go that attended the church. So you can imagine a church that had plus minus 400 people at some point, because there were many meetings of that church. There was a meeting where it was about 300 people, and on the other meeting 200, on the other meeting it was 400. So we had a big number to deal with. So what we learned from that gathering was the fact that even one person can infect so many people, because this virus can travel from one person to many other people. So each person, we had to trace the contacts of one person, because some of the people from the church, they went home. Some used taxis, some they went home in their own homes, and they met their neighbors. So we indeed had to use our epidemiologists, and also partnered with some of the cell phone companies that were able to help us trace the people, as when they left the church, where did they go? So it helped a lot, because we were able to trace most of the contacts from that church, and from that, all the people, in fact, almost all the people that are in Mangaung that have tested positive they do have a relationship to that church. Their index shows that it's from the church, the gathering of that church.
That must have been a real enormous task to take up. Over 400, almost 500 people attending that church. You're contact tracing, tracking those individuals. Did you guys have the capacity to deal with that? And how exactly did the tracing take place with regards to those going out and protecting themselves from possible COVID positive individuals being at the church?
On day one, we went to meet with the church leaders and asked them to call everyone that was in the church. We went with our mobile facility that we were sent by the head office. The NHLS sent us two mobiles to be precise, two NHLS mobile. So that we went with our two mobiles at the church, and the people came. We screened the church members and the elders and everybody. From there, we also went to the hotels where they slept. We tested everybody, we screened everybody at those hotels, and we also encouraged them to already be in to self-quarantine. Some of them will quarantine them at the very hotel that they were staying. Even the very people, the 5 people that came, we quarantined them there. From there, we started using our own enrolled nurses and enrolled nursing assistants together with our community healthcare workers, also backed by the volunteers from the Red Cross, to start now making follow-ups in our communities. And we started getting our people and we screened and tested. That's how we managed. I think we did not lack capacity. We did have capacity. It was helped by these mobiles that came. Yeah.
Okay, let's talk about the current situation. What facilities, what hospital, what medical areas are there for, COVID-19 positive individuals, as well as testing facilities? What is currently happening within the Free State?
Currently, what is happening, our 5 districts have now launched the mass screening, though our main concentration is still at Mangaung, where we got a lot of patients. So we have teams that go into the facilities and they do door to door. We also erect tents next to where we have seen that there have been many people that have tested positive. We erect tents where, as the people are knocking, they do the screening at home and they refer the people to the tent where we are standing with our own mobile, the NHLS mobile, for the people to go and do the testing, those that need testing. Otherwise, others go to the tent and get our people there waiting for them to be screened, because before we could perform a test and take a specimen, you need to be screened so that we are sure that you are the candidate. You are the candidate to be screened. You fit the criteria. So we are working like that. So, and we are getting many people, and we are happy that the response from the community is very good. We announce even in the radio where we are going with the program, and I think we have covered a large number. And the concentration indeed is in Mangaung, in Bloemfontein to be precise, because all our members, many of the people that have tested positive are in Mangaung. As we speak at the moment, Mangaung alone has got 87 people that have tested positive, while the 87, while we have 98 now as the province. After the lockdown, we saw the number did not grow as much as it did before the lockdown. Because before the lockdown, we got many people testing positive, one after the other. And as we were following up, they all had a relationship with the Index Church.
Okay,
the church that we call the Divine Restoration Church.
Yes, thank you for that information, MEC. You have just confirmed that the Free State is still sitting at 98 confirmed cases, is that correct?
Yes, we are sitting at 98 confirmed cases. As for the beds, we did increase the beds. Our own district hospital now, we requested all of them that they must avail their beds within the hospital, get them ready, and get the PPEs and everything ready, and make sure that they train the staff, even the frontline staff, because you know that people can come into casualty without you knowing as a nurse that would be attending to that patient, or even an admin staff, not knowing that this patient is COVID-19. We also organized a training for our EMS personnel who will be responsible for for transporting the patients from their home to our facilities.
Okay.
We also train them on how to handle the COVID-19 patient. We did not forget, if the patient dies, we also trained the people that, our forensic care personnel, that would be dealing with the corpses of the COVID-19 people.
Okay, so to confirm that and other cases of what the numbers are in South Africa, take a look at this. So there you have it. That is the numbers that you see of South African cases. When we continue with our discussion with MEC from the Free State, we'll chat more on isolation, quarantine, and how the different MECs are working together within the different provinces to combat COVID-19 and what they've also learned from each other. More just after this. Don't go anywhere. We're chatting to the MEC of Health in the Free State. Welcome back. I'm Khawa Solomon. Online we have MEC Monseng. Thank you so much, ma'am, for joining us once again. We want to look at quickly the isolation cases. What death rate is the Free State at now? And how are you dealing with those in ICU?
Okay, we've got 3 deaths as we speak, and the 3 of them, two were above 70, and only 1 was below 70. And the other one was a doctor at Mediclinic, was admitted there, was in the ICU, and then unfortunately he passed on. And may his soul rest in peace, and the other 2 people. There we've got now admitted, we've admitted 7 patients in our isolation ward in Bilonomi, and we've got people that are in quarantine in the Tuscany. We have that are in isolation. We have also the relationship with the local hotels that have given us space so that we can isolate our people there that are affected. We also have 300 beds that were offered by Transnet, but we have not as yet used them, but they are ready should there be a spike. We also have 498 beds that are in our hospital, the state hospital, where we could isolate people. That is throughout the province. So we are ready to admit people, even in isolation, because we have found that the self-isolation at home doesn't really work. It brings problems. People don't adhere to the rules.
MEC, has your team perhaps done any work or background work with regard to the medical doctor that contracted COVID-19 and how, with that story, can help other health workers protect themselves?
I don't know whether to say fortunate or unfortunate. The doctor did not contract the COVID-19 illness, the infection from the hospital as he was working. He's also related to the church. He was part of the church as well.
Okay.
And he got the infection there at the church. Okay. Unfortunately. Yeah, so all that we need to say to our health workers is they must take care. They must make sure that they are protected. They wear their protective equipment, clothing at all times. They must never forget to wear their protective clothing as they deal with the COVID-19 patients, have their gowns, have their masks, so that when they go home, they take off these masks and the gowns and they leave them at the hospital so that they do not take the infection with them back to their homes.
Okay, let's look at the facilities that the Free State has available. You've mentioned over 300 beds that has been supplied, the B&Bs and various hotels as well. Do you think this will be used within the isolation period? As we know, many are situated within informal settlements. What will the isolation facilities be used for?
The isolation facilities that I've spoken about in Mangaung, I think we have more than enough beds. But with the other districts, we are still, in fact, the Department of Distia has allowed us to use their own facilities, but some of them are not as yet ready. We are trying to correct them, especially on the ablution facilities. The other isolation beds, in fact, it would be used as a field hospital. We have been talking. We've been talking with the Department of the military so that they can avail. There's a barracks at Dihlabeng that is not being used. That we were trying to say that barracks, if it's ready, we could use it as our field hospital. Should we need to admit more than we can cope as the department? But at the moment, we still have enough beds. Like I said, we have 37 beds, but only 7 are used now in Pelonome, and we've got about 200 in visitors that are still empty, and we have others in other hospitals. So we still have enough. We're just getting ready for the spike if it happens, as we have been advised by the recent research and what has happened in other countries, what we have learned. So we don't want to be found wanting. We've got other 2 hospitals that are new that we have also prepared. That is Senorita Ntlabati and Albert Mzula. So we're quite happy with what we have now. Around Bloemfontein, we think we have enough beds.
Okay, because that's exactly what... Sorry, Missy, I was just going to ask, South Africa hasn't yet seen the exponential growth, that spike that you've mentioned. So is this the calm before the storm? You'll answer that just after our short break. Please take a look at this video from our IMA doctors who is out there working while you need to stay at home.
Yeah.
Peace be upon you, my brothers and sisters of South Africa. My name is Zahir Esop and I'm an anesthetist. Coronavirus has come to challenge the people of South Africa. I would like to leave you with 4 messages. Number 1, be safe. Stay home, practice social distancing, and obey the authorities when they instruct us. Number 2, be prepared. Know your symptoms, know the number to call, know who to call, and know when to call. Number 3, be strong. Maintain your fitness and remember your physical, your mental, and your psychological well-being is very important. And number 4, be kind. Remember those in this trying time who are less fortunate than us. Give of your time, give of your wealth, give of your knowledge and expertise, and see where you can fit in. I pray that the Most High lets us rise to the challenge and overcome this. Thank you.
Dr. Zahir Esop, anaesthetist and member of the Islamic Medical Association of Southern Africa, giving his message to everyone at home. When we get back, we talk to our NGO, highlight the mosque in need, and then continue our conversation with MEC. Stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. A very good day to you. We continue our conversation with MEC, but before we do that, we link up with the organization for today and we're profiling the Natal Memon Jama. Online we have Ahmed Osman. Assalamu alaikum to you, Ahmed.
Wa alaikum salam wa rahmatullahi wa barakatuh.
So from Natal Welfare Department, tell us what you guys do, which areas do you reach out to, and how can people get hold of you if they need help?
Okay, NMJ Welfare, alhamdulillah, is currently trying to provide aid in the form of food hampers, water, bread, and soon our blanket drive is coming, as winter is coming. The areas that we've worked for thus far is Naval, Sydenham, Waterloo. We went as far as Ikopo, Quadaguza, which is Tanger, Ladysmith, Paul Petersburg, surrounding areas of Durban, Chatsworth, Phoenix, and many, many more areas. How you can help us? Well, the first thing I think is important is to feel compassion towards these people that are in need. I've seen personally the desperation in their eyes. People are hungry. And in compassion, there is humanity. And in humanity, there is generosity and love. So what we are asking from NMJ Welfare is that everybody kindly contribute towards our project. Anybody that's wishing to contribute, they can WhatsApp or they can call us on 078 1786 132. That's 078 1786 132. If there are any requests also from any of the community members, we are willing to facilitate, inshallah, how we can help them better.
Ahmed Osman, shukran so much for your time. All the best, and may you guys have the strength and the ability to continue the great work that you're doing. Amen. Assalamu alaikum.
Ameen.
There you have it, Ahmed Osman. For that details you've missed, please WhatsApp us and we'll send it through to you after the show. Note that today's masjid that we'll be highlighting to give donations. As we know, the funds are very low and they're not even coming in at various masajids. So today we're highlighting the Jamia Masjid, and that is in Cape Town, Bukap, Lower Kapini Street. This masjid has been around since the 1800s, 1850. They are located at Lower Kapini Street, Bukap. Resident Imam is Imam Moti Saban, a prominent marriage class instructor who's been doing this classes for over 20 years in Cape Town. So please donate generously to every masjid, and today we're highlighting the Jamia Mosque in Bukap. So we'll continue our conversation with the MEC of Health in the Free State. Thank you so much, MEC Monswang, for holding on. I've mentioned just before the break, is this the calm before the storm?
Yes, it is. We have been told by the experts, they told us that indeed this is the calm before the storm, and I agree. Because this calm, it came about because of the lockdown. It's as a result of the lockdown. Once the regulations are eased and people go to work, most of our people are using public transport, the buses, the taxis. Yeah. That is where then they start infecting each other, and the number would be going up again. Our cab would then be going up again. So we still to see more people getting infected.
So MEC, you've mentioned in our telephonic conversation that you and various MECs within the provinces of South Africa meet together with the health minister. What have they learned from your incident with regards to the church, and what is being discussed strategically going forward?
Every time when the minister needs to see us, we create a telephonic meeting, or we meet through the boom, yeah. So we give the report from each province, and that is how we learn how the strategies that each province has used, and we also talk about what is it that we can do. The issue of the mass screening came about through the meetings that we have, that each province must start now to prepare for mass screening and testing, because at this point in time, because there's lockdown, we are now dealing with the local transmission, local people infecting each other now. We don't talk about people coming from other areas or outside the country bringing the infection at home, but we are talking about local transmission. For us to be able to deal with the local transmission, then the lockdown had to happen, and we are indeed succeeding, and we have managed to make sure that the curve then flattens. Yeah.
Thank you so much, MEC. 30 seconds to wrap up quickly your concluding comments.
My concluding comment is that let us all take care. Nobody alone can defeat this pandemic. We have to hold hands, we have to work together, and our communities, please stay at home. Listen to what the president has said. Stay at home and be safe. And once you know that you see that you've got flu-like symptoms, please go to the health center so that you are helped. Thank you.
It's a pleasure. The provinces within South Africa is gearing and ready. Thank you so much to MEC Monsweng Su and her team is ready in the Free State. We will be interviewing various provinces as well to find out what facilities they have for you. Please do interact and tell us what you would like to see, what you'd like to hear, and the questions you'd like to ask these MECs, these various individuals and spokespersons within South Africa. Be part of tomorrow's show as we look at homeschooling during this lockdown, COVID-19. We will have more informative shows just for you. Do stay with us. Every Monday, Tuesday, Wednesday, weekdays till Friday, 4 to 5 p.m. Health Matters COVID-19 Extra. From myself, Hawa Solomon, and our team, wassalamu alaikum and goodbye for now.